Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we've got big sort of changes going on in Pennsylvania's hospitals, particularly with reimbursements and how that will affect you, plus transportation funding, roads, bridges, mass transit, huge needs out there. What's the state going to do about it? We'll find out when Pennsylvania Newsmakers returns.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hey, welcome back to the program. Well, joining me is Scott Bishop. He's the Senior Vice President for State Legislative Services with the Hospital and Healthsystem Association of Pennsylvania. We got to stop these long titles. Everybody that comes on here has these long titles. You're Scott, and you're with the hospital. Is that okay?
Yeah, that's great.
Great. Okay, Scott. Look, what's fascinating to me, I've just learned now, I'm a new grandfather, and my daughter-in-law gave birth, and now I'm learning that one of the proposals would be to reduce the funding that hospitals get for normal childbirth. Is that right?
That's right.
What's that about? Talk about that a little bit.
So part of last year's budget, if you recall, the legislature gave the Department of Public Welfare Secretary some additional powers to do some regulatory change without having to go through the rigmarole of the state regulatory process, which on the face sounds like a good idea, but the downside of that is a recent policy decision to do exactly what you said, which is to reduce payments for normal newborn births, especially in those rural, small community hospitals across the Commonwealth.
Wow.
So, you know, access to OB services is already a challenge in those parts of the Commonwealth.
Oh my gosh, yeah, because we hear all the time about limited number of OBGYNs, and you got other specialties, primary care, and that's something in upcoming shows I want you to come on and we'll talk about this real concern about access. And you know, we got also, you always worry about the quality side of it. So what does that really mean? I mean, does that mean, do you think that people giving childbirth will say, whoa, wait a minute, maybe I got to go somewhere else? But how do you do that when, you know,
So when you're
ready to have a baby and all of a sudden you say, well, I got to go, what, 60 miles
60
away?
miles. I mean, that's the concern because, and there was a time in the Commonwealth where we saw hospitals stop doing OB services. So it's not hyperbole. I mean, it's part of the reality. And so, you know, we're working very hard right now to try to convince the administration it's not a good way to go.
Explain what would happen if in the budget that gets passed, that, you know, will be passed hopefully by June 30, is this an item that would be included in this year's state budget that you're working to change, or is this a Department of Public Welfare administrative policy?
This is an administrative policy, so it's a challenge of kind of a pre-budget issue. We got to fix this budget issue before we can get into the budget issues. We've got a bunch more challenges for hospitals.
And it's more difficult because it's not like you can go to legislators, although you may want to do that to help, you know, convince them.
And we're trying that, but you're right. The whole point of Act 22 was to take this out of the regulatory process, so that's our challenge.
One of the other things that we've talked about is, you know, particularly when you get to rural hospitals, is when you look around at rural Pennsylvania, you've got colleges and hospitals are often the main employer, and so these cuts, and we'll talk about some others in the next segment, ultimately have an impact on the employment and job growth in rural communities.
They absolutely do, and you know, part of the governor's budget message has focused on jobs and economic development. What we're trying to say is, look, we're a 600,000 job, $100 billion part of the Pennsylvania economy, and so we should be considered as such in addition to the health care we provide. So when it comes to budget cuts and things like that, that's going to have an impact. Because remember, there are no Medicaid hospitals, there are no Medicaid doctors, and there are no Medicaid wings. I mean, hospitals serve everybody, and it's all patients. So these cuts have that impact on them.
Now, in addition to childbirth, aren't we talking about burn care and trauma care? Talk a little bit about that.
So we've got hospitals that specialize in some of those things: trauma centers, burn centers, critical access hospitals, places where that's, you know, the only show in town per se. Now this year's budget, typically in years past, the special funding for those kinds of programs start at zero. I mean, we do recognize the governor's proposal starts us at 90% of funding, but that's, you know, still a reduction on top of previous year's reduction. So that has an impact on these hospitals and their ability to continue to provide those services.
All right, this is a pretty good update. I don't think a lot of our viewers are aware of, you know, this kind of proposed changes that could take place. All right, we're going to take a break. When we come back, I want to ask about the current budget freeze and what that happens to mean to Pennsylvania hospitals after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program with Scott Bishop from the Hospital Association. We're talking about these big impact changes. And these are going to have an effect on consumers, on users of healthcare, obviously. You know, one of the things that I keep noticing both out of the federal government, you know, we get these recommendations on Medicare and Medicare changes, Medicaid and Medicare, and even at the state, is they seem to be looking to cut the providers. Now, if you get these reductions, and I want you to talk about, you know, a few of them, doesn't that mean that you hospitals have to make up the money somewhere else? I mean, you can't just say we're going to cut all these funds and then not. Go ahead.
That's right. So the impacts that have on hospitals come in a couple of different ways. Yet again, remembering that hospitals have to take all patients, right? So our mission is 24 hours a day, 7 days a week. So when we have to care for patients and our uncompensated care costs go up, right, that prevents hospitals from doing other things. And again, that impacts all patients. And so the more we see in reductions of reimbursements, the more we see in changes of policy that result in more and more folks coming to through our doors without insurance or whatever the case is.
What's kind of interesting, Scott, I think, is that politicians in both parties are loath to say, you as a consumer, we're going to cut you. You as a patient, you're going to get the cut. So they cut the providers of the service because they think that's politically more palatable than going after the patients. And that seems to be what we keep seeing out of both state and federal governments when they want to cut health care costs.
Yeah, and if you think about it, I mean, uncompensated care for hospitals has reached the $1 billion mark.
And in PA?
In Pennsylvania. And that number keeps going up. And again, those cost shifting, it comes up a hard stop sooner or later. And so it starts to impact. You're right. It's going to impact all patients because it's not just Medicaid services for Medicaid patients in hospitals, and that's the growing problem for hospitals. I mean, we get the fact that we're partners with the Commonwealth in caring for the most vulnerable citizens, and we also understand that it's going to come at a cost lower than what our costs are to help those folks, but. There's a point where you can't just assume that uncompensated care hospitals can just take that and go through
and I think that's particularly true for Medicaid. Now, Medicaid is health care for folks at low income, below the poverty level, is that right? Poverty level and below. And that's what it is different in each state. May not be true.
That's right. That's the Medicaid. Medicaid is the state version of all this, and Medicare is the federal program for seniors and things
now,
like
but the point I want to ask you about is that Medicaid payments in this state have been over $1 billion less in the last couple of years, which translates into problems for hospitals because, again, you have to make it up in another way. Plus, aren't you also contributing money back to the state in a tax that you pay?
Absolutely. So, this is tough fiscal times, tough economy. We get that. And again, in our partnership with the Commonwealth, we agreed to tax ourselves to not only recoup some of the costs that we need in terms of Medicaid reimbursements, because remember, we draw down federal funds for that, but at the same time, that generated just about $340 million in new tax revenues for the state's general fund. So clearly, it's a good thing for hospitals to try to get our reimbursements up, but at the same time, it's a good thing for the Commonwealth because those are new, in a time where new tax revenues are hard to come by, there were revenues that the administration, the governor can use for general fund issues and priorities.
I mean, before I let you go, if there's sort of one thing, one message that you would say to lawmakers given this budget, what would it be? I mean, I know you have a bunch of things you want to do, but there's always one that really sticks out. Go ahead.
It is. You know, the governor has talked about, and others have talked about, in tough times, must-haves and nice-to-haves. And if you ask me for one message, and that is, adequate hospital funding, not reducing hospital funding. It's got to be a must-have in the state budget.
Right.
Otherwise, we can't give the care, the core services the hospitals are supposed to do. It just, the pressure starts to mount up. So that would be that single message. We're a must-have.
All right, thanks for the update. All right, coming up, the state has a huge need, something like $1.7 billion a year. By an earlier study, some have said $3 billion a year to repair the state's roads and bridges. That's not build new roads. It's not construct new bridges. It's not construct new roads. It's repair what we have. We're going to chat about that and the prospects that in the near future, Pennsylvania will do something about impairing its infrastructure. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, now I know if an astute observer is going to say, now Madonna doesn't have the same coat and tie. What's that all about? Well, we taped this at different times, so I have a different coat and tie. So if you pick that up, you're a pretty shrewd observer. Hey, joining me, as often is the case, is Bob Latham. He's the Executive VP at the Associated PA Constructors. We talk transportation. What are we going to do about roads, bridges, and highways? Man, all right, before we get into 2 or 3 things we want to talk about, for our viewers, outline the problem.
Well, as always, we've talked about this quite a bit, Terry, and one thing I'm going to point out this time is that we have a funding gap in Pennsylvania on our roads, bridges, and public transit. We've had 2 commissions, 2 commissions from different governors and different political parties that have set the stage saying we're underfunding transportation by more than $3 billion a year, and that's across the boards on everything we need. And that's a lot of money, and nobody has ever challenged that number because it's a fact. And that means, again, we have a huge system, 40,000 miles, where our surface, we don't have enough to do that and reconstruct those roads in a proper manner, so we're kind of putting Band-Aids on them and keeping bridges open.
I'll tell you, just anecdotally, I mean, I drive a lot around this state. I mean, I will tell you, potholes and, you know, you just can see it now. I mean, you don't have to, I'm no engineer.
Sure.
But you can just see the physical deterioration of the roads.
Well, that's exactly right. It's something we have to address. It's a major economic driver, and if we continue to neglect it, it's going to be a continued problem for the Commonwealth.
We want to do a couple things. We want to talk about some research, but before we do that, talk about what you think is likely to happen here. Now, I know you've been meeting with officials in state government. I know you've been working hard to try to get a realization. I mean, everybody realizes the problem, and as you point out, 2 commissions say let's do it. Talk about where you think this might go.
Well, where I think it is right now is in this, we're focused in Harrisburg because we believe that nothing's going to happen in Washington. There is a federal highway program. It continues to get kick the can down the alley, as they say. We're not looking for any help from Washington. So we've got to take care of our own here in Harrisburg. Now, what you see is people on both sides of the aisle voting in favor of funding transportation. Earlier this week, the House of Representatives, which has been identified as, well, they're the problem, they may not go for it, well, they overwhelmingly approved a public-private partnership bill, which, you know, there is no free lunch in transportation. The public-private partnership bill would build a few major projects, but at the end, there's going to be some sort of user fee or toll associated with that, and the legislators understand that. So I think there's support in the General Assembly. Secretary of Transportation Barry Shoke,
who's been a guest on this program, by the way.
Been on the program with you, and obviously a great advocate for better highways throughout the Commonwealth, indicated at a Senate hearing recently that he and the governor we're going to be meeting with legislative leaders here sometime in the very near future. Now we're here in April, maybe sometime in the next couple of weeks to see what's possible, and we're hopeful that that this support you've seen in the General Assembly will translate to those meetings, and we'll get to work on this here.
I mean, one of the things that you hear, and I think the Secretary has said this, and I think Senator Corman, Jake Corman, I'm talking about, who chairs the Appropriation Committee, saying that we're paying now. We're paying now for bad roads, and we're going to pay more, and if they don't get any better, it's sort of like throwing good money after bad. Maybe that's a bad analogy.
Well, no, it's a good analogy, and the point is the Funding Commission, which now was way back in August that it issued its recommendations. It set out a series of ways that we can fund transportation, and in the first year, the average motorist would pay about 70 cents a week. I mean, that's less than a cup of coffee in some places. And think about it. If you're wasting 1 gallon of gasoline a week or 2 gallons of gasoline.
By driving a little too fast?
Well, no, by driving too slow. In other words, sitting in congested roads.
I get it. Good point.
Roads. You're sitting there wasting gas. Yeah. That's $8.
Sure.
I mean, $8 versus 70 cents.
Sure.
So you're going to, it's like the old... what was that, Fram auto filter? Pay me now or pay me later. You want to pay for bad roads or you want to pay for good ones?
All right, let's run to a break, and then when we come back, we want to talk about some research about what people think about what should be done about the problem. All right, we'll be back after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back to the program. I still have the same coat and tie. I didn't run out and change at any rate.
Me too.
Bob Latham, yeah, he's here. He didn't change in a second. All right, Bob. Before we get into these numbers again, how optimistic are you? I mean, this is a tough struggle. The voters of the state, the residents of the state, and survey after survey, I've done some of them. Be candid. We're going to be candid about this for Bob and other organizations.
Sure.
We're independent here. We don't take sides, but we do some research. How optimistic are you, given the fact that over and over again the residents say, yeah, we understand the problem? Go ahead.
Well,
you have to be optimistic.
I'm very optimistic.
Good.
One of the things I'm optimistic about is that, again, we've seen support in the General Assembly for transportation funding in the passage of 2 public-private partnership bills, and they will require, if those are implemented, some degree of payment by the eventual highway user, and so I think people get it. They understand there's no free lunch. Let's look at roads as a utility for once. The General Assembly passed legislation that allows utilities to pass on their infrastructure costs. You and I just get a letter in the mail from the water company saying we've got to put in new lines and you're going to pay for it.
And PPL just said they're going to increase my rates. Except I locked in the rates, but you're right. Your point.
The bottom line is that we do understand that if you're going to have good roads, you're going to have good schools, you're going to have to pay for it.
Yeah.
Now, there's a certain segment that's saying no, we don't have to pay for anything.
But the other thing about hold on a minute. But the other thing about it is that when we're talking about roads and bridges, we're not just talking about the way people get around. Us average folks, but you're talking about businesses, about whether they're going to come here and set up plants and do manufacturing and do technology.
I met last week with a fellow down in the Philadelphia area, and his company is an advisor globally to companies looking at where are they going to locate their businesses. The number one consideration is what kind of transportation facility, be it ports, railroads, and access to highways. So when they look at where they're going to site, it's what kind of transport, and that's
education.
True today as it was 1,000 years ago.
Transportation and education. They want the kids to have good schools. All right. Look, over the years, surveys have been done. I've done some. Many others have done. They're trends. Just get into the big issues with the trends. The public says.
The public says that if you're going to make it safer and more convenient for me to get around, I support funding this program. I think it's something that really needs to have attention. The public has said over the last 6 months to a year that this is one of, if not the most important issue to be dealt with. The most recent poll shows that issues like privatization and vouchers and things like that are very low on the priority list. And the priorities are what are we going to do about education and what are we going to do about transportation?
Yeah.
That's what they
say. Now, the other thing is that the more it gets related to jobs, the higher the support.
That's correct. Yeah. Almost over 90% once you equate that to jobs. And we have done scholarly studies that show that most of the jobs are not even in the engineering and the construction sector, although we do have a lot of good family-paying jobs.
Well, there was a transportation program funded study that showed 50,000 jobs. Is that right?
That's about right.
By the way, isn't that close to the job? I could be wrong about this. If I'm wrong, I'll get some email about it. That they said would be created by Marcellus Shale. In other words, we could, be talking about between Marcellus Shale and improving these roads and, doing what we're supposed to do, about 100,000 jobs in this state.
The gas industry is very important to the state. Let's look at the cracking facility that was just awarded to Beaver County.
Yep.
Why did they locate it there?
Yeah.
Transportation. It's right near the river, so they can send that product down the rivers. And that's another issue because we got locks and dams problems out there.
Yeah, and we had Scott Detro on from State Impact PA last week, and he made that very point. Well, certainly about the good thing that they're coming here and the jobs that they would create. And you just make the collateral point that it's up to. Now, I want to explore just for a minute this other element. The jobs just wouldn't be in constructing, or repairing the roads and the bridges, but they would be in a whole assorted other fields.
Well, PennDOT, one of the things that nobody realizes that, when they think about road construction or PennDOT, they think, well, it's government people doing the work. It's actually employees of private companies, and they buy stuff in order to fund in order to do the project. 75 cents out of every dollar spent in PennDOT's budget goes to the private sector, which means it comes back to the state in terms of taxes. It goes back into the economy, and it could go into the manufacturing sector. It can go into the retail sector. It has a broad impact across the economy.
Well, I want to thank you for coming on. I mean, I think this has been this update that we do is very helpful. All right, I want to thank everybody, particularly our viewers around the state. WGAL in February, we're still the most watched show other than Meet the Press on Sunday here on WGAL and around the state. To thank our viewers. We'll see you next week for another edition, and stay well.